Um, so I want to give a big thank you to all the speakers today. Everybody I asked to speak did such a great job, and we were working to such a fierce time scale. So thank you so much. And we've heard from a great mixture of disability and family leaders from Sheffield, Yorkshire and beyond. And we've heard from other experts, people who've spent large chunks of their life committed to making this system better, trying to make it better. And we've heard some stuff that really touches the heart, the things that Catherine was saying, the things that Claire was saying, John's observations, which to me just are really powerful observations on the long-term failure of this system to reform itself. So I'm not going to try and summarize all of those things, but I do want to talk about the big issue that keeps getting ducked, has been ducked for decades, which is the money. In 2010, the coalition government introduced the biggest cuts in public spending we've ever seen. In 2010, the UK spent 42% of GDP on public services, not a high figure. Most Northern European countries spend much more than that. Just 10 years later, Treasury data puts us at 36%, a figure which now makes us an extreme outlier alongside other countries with no secure welfare state. This is a cut in today's terms of £133 billion. As the United Nations has repeatedly told the UK government, these cuts have particularly targeted disabled people and are in breach of the government's human rights obligations. The attacks on disabled people have come in the form of cuts to benefits, housing, and especially cuts in social care, which have become even more extreme than the general cuts in public funding. In 2010, social care spending was a little more, that's adult and children together, a little bit more than 2% of GDP. Today it is only 1%. This means that in real terms, social care spending has been halved in just 10 years. And today the adult social care system, for example, supports more than 40% fewer people than it did 10 years ago, despite our aging population. You might wonder how a system can survive this kind of radical surgery by government. But the reason why social care, the system survives, is that the costs of the cuts to social care are always exported somewhere else. Primarily, they're exported into the lives of people and families. They harm people and families. And we see the symptoms of these, as various speakers have emphasised, Brian, at the beginning of the day, in the growing death rates, in suicides, in misery, in hate crime, in family breakdown, and in institutionalisation. But you also see the impact of these cuts in costs that appear further downstream in other more expensive public services, the NHS, in schools and in prisons. So the system doesn't crash, it just becomes increasingly inefficient, increasingly dysfunctional. By failing to support someone to be an active and connected citizen, part of their neighbourhood, we end up with people in institutional placements, as John described, that can cost over £200,000 per year. The good news, the ever so slim silver lining, is that the governments of the last 10 years have demonstrated that social care funding, finding a solution for social care funding, an issue that's rolled on for 3 decades, was never a matter of complicated calculations of demography. It was never about need, growing need or otherwise. It was never about markets. It is, as Ruth emphasised, social care spending and our commitment as a society to invest properly in social care has always been a matter of political will. It's always been about morality. Do you want to do the right thing? Do you want to respect people's human rights? If an extreme right-wing government, and that is sadly the government we have, can cut social care spending in half because the government doesn't value social care staff, doesn't value disabled people or families or neighbourhoods, then a progressive government could do the opposite. It could choose to radically increase spending precisely because it does care about people and it does care about communities. In fact, a progressive government today, if it was such a thing was possible, could easily double public spending on social care without even taking us beyond the spending commitments of 2010 And as we set out in a recent report, if we did double the tiny social care budget, then we would be able to end two of the most shameful features of the current adult social care system. We would be able to get rid of charging and the vicious means testing, charges that are effectively a super tax on disabled people. Fundamentally, we need a universal social care service, not a service targeted on poor people, which, as Richard Titmuss used to say, a service for poor people becomes a poor service. Social care is a brilliant, sadly, case study of that truth. The current system is disastrous. People make themselves poor in order to qualify for it. People lose modest savings or disability benefits, and the better off are excluded from the service and so have no interest in supporting it through taxation. At the same time, we could also, again, just by going back to the 2010 commitment to 2% of GDP, we could lift the salaries of social care staff and personal assistants by about 50%. Current salaries are so low and contracts so insecure that many social care staff must rely on universal credit. Isn't it shameful that we subsidise social care salaries through our dreadful social security system? Of course, this is all very well. We are a long way from having a progressive government. In fact, the UK seems to be on course for another decade of extreme right-wing power. Opposition parties remain divided, and the electoral logic of the current system makes an outright Labour victory look almost impossible. But that doesn't mean there's nothing we can do. Parties on the left could agree to work together to develop a progressive vision for social care, perhaps something like a New Deal for communities. This is an easy win. The policy of working with the Conservatives on social care has been disastrous. It has simply left progressives becoming complicit in the destruction of social care. This must stop. Labour, Liberal Democrats, Greens, I'd say the SNP and Plaid Cymru too, can surely agree on the need for universal social care and a new approach which invests in disabled people, invests in families and invests in local communities. And this is easily affordable. And even without support from Westminster, even in our broken political system, there's still much we can do today. For example, here in Sheffield, we have no Conservative councillors. That's the kind of brilliant city Sheffield is. We don't elect Conservative councillors, but we do need Labour, Green and Liberal Democrat councillors to work together in the years ahead. We need a progressive alliance for this city. And even without new centralised funding, there are many changes we can focus on. We can work to eliminate charges now. We can work to lift frontline salaries now, because the old industrial model of social care, as so many of the speakers have pointed out, is so inefficient. Local area coordination, peer support, family leadership, gender-based support, self-managing teams, individual service funds, locally organised care and support, good social work, creative brokerage, all prevent needs, all save money, and perhaps most importantly of all invest money directly into the hands of disabled people, directly into the hands of families, and directly into local neighbourhoods. Just think about the waste we've built into our current system. Disabled people and families are unable to use their budgets creatively. This creates waste. Families break down for lack of support. This is so wasteful and damaging. People are sent out of their neighbourhoods, out of the city. This is so wasteful. There is too much wage inequality. The huge wage differences between frontline workers and managers is not only unjustified, it's incredibly wasteful. We allow profiteering and money to be sucked out of the city into the pockets of US investors. There is little or no focus on prevention, on neighbourhoods, on peer support and citizen action. We throw our people away and we throw our money after them. We can stop this now. During the COVID crisis, we've seen the willingness of local people to reach out and support each other. The emerging movement for neighbourhood democracy and the flat pack democracy movement are calling for people to become active citizens at the neighbourhood level. The UBI Lab network, formed here in Sheffield, shows how we can reform social security systems to support citizenship and to support disability rights. Sheffield is ideally positioned to lead in this work, to show that we can combine respect for disability rights and citizen empowerment with approaches that enable us to take care of each other and our local neighbourhoods. We must no longer invest in the old industrial, congregated, segregated system. We must invest in disabled people, in families and in our neighbourhoods. This is the key to progressive social care reform. We must invest in ourselves.